All right. Welcome to this first episode of the Provider Accessibility Initiative COVID-19 web series brought to you by the National Council on Independent Living and Centene. I'm Tim Fuchs with the National Council on Independent Living. I'll be your host for the series, and I'm thrilled to be with you today. So joining me on this first episode are Kelly Buckland, Nichols Executive Director, Amy Hyten. Amy's a licensed attorney and the Executive Director of the Topeka Independent Living Resource Center, a disability rights organization in Topeka, Kansas, and Dr. Bonnielin Swenor, Associate Professor with the Johns Hopkins School of Medicine and Director of the newly established Disability Health Research Center there. So thank you so much, you all, for being here with us. I really appreciate you taking time to join us and share your thoughts. So, of course, we all know COVID-19 has gripped the nation, the world really, in the past few months. And we know that people with disabilities face some unique impacts and risks, not only from the disease itself, but from the public response to the epidemic. And so I wanted to ask you all some questions today about ways that doctors and providers can minimize those risks and best support people with disabilities that are their patients and customers. And we don't use the word patient in independent living very often because we believe that disability is not a medical condition, but a natural occurrence in the human life experience. But of course, we know that for many of you that are doctors, nurses, and in the healthcare profession, that they are your people with disabilities are your patients. So when we use words like consumer or customer, of course, we're referring to the people that you all see and serve. So I'm going to start with you, Kelly, and I'm wondering, I want to ask you a broad question. What's the most important thing that doctors and providers can do today, can do right away, to improve access for people with disabilities?
Thanks, Tim. Well, I think one of the most important things is to use telehealth whenever possible. Insurance companies and Medicaid and Medicare really are paying for telehealth now for almost any visit. And that helps you avoid crowded waiting rooms. And really, this isn't just for containing the spread of the virus, but it's also because a lot of people with disabilities will not have access to transportation or supportive services to get to your offices. Another thing would be to prescribe at least 60 days allowance for prescriptions. Again, health insurance companies are paying for that. This is for disabilities do not need to be going to the pharmacy, and many won't have transportation or supportive services to get there. And then remember, public transportation is being scaled way back, and in a lot of rural areas may not be available at all. So, and the final thing for me would just be, don't make judgments about the quality of people's lives because they have a disability. Numerous studies have shown that people with disabilities enjoy the same quality of life as their non-disabled counterparts. So thanks to both.
That's great, Kelly. Thank you. So, Bonnie, I have the same question for you. What, in your mind, what are the things that doctors and providers can do right away to improve access for patients with disabilities during the COVID-19 epidemic?
Yeah, well, I just want to echo what Kelly has importantly discussed. All those points are critical. Additionally, providing medical information messaging that is accessible. So that can include telephone, text, online messaging so that you can reach a wide range of the population. And in addition to making sure that you're providing medical and public health information that's accessible, it's also important that people are considered in emergency public health and medical planning while it's being developed, implemented, and as we're seeing in COVID-19 response, as it's evolving. So that can include things like making sure that there is an allocation or repository of accessibility and in areas that are part of the medical facility that are responding to the COVID-19 surge, so that when individuals with disabilities are coming into the healthcare system, that those items are available. when people with disabilities arrive. And beyond providing accessible equipment, the consideration should be about communication. So in this instance, making sure that people with disabilities have access to a Wi-Fi room might be one opportunity, so that they can utilize their own accessibility applications on smartphone devices if that's what they prefer. But also understanding that not everyone has access to that. And providers should be ready and able to be flexible and work with individuals on their communication preferences and on their accessibility preferences, even in light of the response.
Use personal attendants in their homes to help with getting out of bed, bathing, grooming, getting dressed, all manner of daily activities. And so I wanted to ask you, Kelly, what are some of the unique challenges for personal attendants and on top of that, what are some things that coordinating agencies of attendants can do to help mitigate those problems?
So thanks, Tim. I think one of the most important things that people can do in regards to this is really empower the consumers to communicate effectively with their providers. This isn't a time for them to be shy or worry about offending people. This really is a time for them to protect themselves, and they need to feel that they are empowered to take control. Ask your attendants to be washing their hands regularly, disinfecting surfaces like the doorknobs and oven handles, microwaves, faucets, all that kind of stuff. What we don't want to be happening is passing the virus between the consumer and the address the issues regarding the agencies.
Great. Amy?
Yeah, this really is the time for agencies to establish their place as really being integral parts of accessible and integrated communities. So providers really places that consumers may not have access to in terms of information, in terms of technology, and that gives providers an opportunity to really step in and help consumers put meaningful plans into place. So some different ideas for the way agencies could help folks about what, if any, durable medical equipment might help them to do tasks more independently. As Bonnie mentioned earlier, this may be a place that medical facilities may have some resources to help. People don't necessarily know what is out there that they might be using, that they could get a hold of that will make them more independent and have less need for close contact with care attendants. So additionally, information in terms of lists of community resources that can fill in tasks for their workers, restaurants that deliver supplies that can be delivered. Agencies can update their worker registries. They can call the people who are on those registries and make sure that they've got current information to make contact, and make sure that those workers are healthy and are protecting themselves and staying healthy so that they'll be available to help folks if and when the time is needed. And then finally, anything that agencies can do to provide or advocate for others to provide safety information and personal protection equipment for workers and for consumers. And this does include, as Kelly mentioned earlier, even things such as helping workers get to and from a workplace through private conveyance instead of having to use public transportation. And the same is true for consumers to access necessary community resources. Thanks, Tim.
Great. So the next question will be a surprise to no one. Telehealth has been a big topic lately, and we're seeing a lot of providers moving to telehealth, seeing a lot of patients and customers wanting telehealth to provide services without having to meet in person, right? So we all know why that's so important right now. I wonder, Bonnie, I'm going to start with you. What are some of the unique access issues for telehealth for people with disabilities that doctors and providers need to be aware of?
Yeah, this is a great question. When you're interacting via telehealth, again, communication, I think, is the common theme here. Communication has to be considered. Way that providers are interacting with their patients and consumers, that needs to be established, and there needs to be flexibility in that. So I think for providers' perspective, they need to understand what options are available to them. Most systems have more than one HIPAA compliant option, for example, and there are not all consider and understand those options and offer flexibility and discuss those options with their patients so that they can provide more opportunity to have telehealth appointments with their entire patient population. That patients understand how to connect with providers during this time is critical. Not all patients are comfortable with this new framework. And again, I think communicating with patients is critical, that these telehealth options aren't necessarily going to translate into poorer care, but they are a way to connect with your provider during this challenging time.
Great, thank you. And I want to come to you next and ask you the same question, just from your perspective, any other unique things about telehealth, all types of disabilities that doctors and providers need to keep?
No, absolutely. Thank you, Tim. Yeah, telehealth is a fantastic option for a lot of instances, but we do have to be very mindful of some of the limitations of telehealth and some of the specific things that need to be taken into consideration when using it. So, for example, providers should be very aware of the cultural and communication barriers that are unique to the deaf and hard of hearing, and people who have low, as well as people who rely on augmented assistive communication. So for example, for deaf folks, make sure that providers aren't wearing masks, and that because that mask may obscure your face, it may make it more difficult for an interpreter to clearly hear and interpret messages. And most importantly, you're going to be removing important facial cues for interpreters and your deaf and hard of hearing patients to use. They rely heavily on facial expressions to build context and meaning. And then you also need to remember cues and your demeanor. And so telehealth may provide an inadvertent tell, or could give a mixed message if your demeanor on that telehealth call isn't consistent with the type of demeanor you would have in person. Additionally, remember that if you're using telehealth, people who are blind or low vision are now relying on just what they're hearing, and they're not being able to see what's going on in the room. So if someone comes into the room, or if you leave the room, a blind or low vision patient on the end of that line is not going to be able to see that. They're not going to be able to see head nods or other nonverbal expressions. So be certain, if you're dealing with those folks, that you say, instead of nodding, say what your yes or no, and describe anything that needs to be communicated visually. Finally, make sure that your telehealth platform works with any assistive communication device the patient is using. So keep in mind that it is your system, whereas, this is maybe the platform that you have. Similarly, for the person receiving that communication, that assistive communication device is the platform that they have. And so if you're going to use telehealth, you need to make sure that the platform that you have meets them in the communication space where they're at, not vice versa. Sometimes in this instance, it may be best just to make a phone call or look for another community resource to help with that communication. Thanks, Tim.
Great. Thank you, Amy. All right, Bonnie, I'm going to come back to you. I know that we've all seen and maybe experienced, some of us, doctors and providers canceling appointments, elective procedures, and other things to reduce the strain on the healthcare system. Most of that really positive. It's not a good time to be going in for things to the hospital or doctor that you don't really need. We know that there are ongoing appointments, procedures, services that may be non-essential to some people, but for people with disabilities, including people with chronic health issues, they can really be essential or even life-saving. So what are some things that doctors and providers need to keep in mind, and how can they best prioritize and keep those types of appointments on the calendar for people with disabilities?
Yeah, thanks, Sonny. This is a great question. Yeah, so it is, as you're saying, important to acknowledge that these decisions about appointments are weighing the risk of COVID-19 infection with the benefit of having an in-person visit, and they really should be considered for each individual while operating within the policies of each health system. And again, I'm going back to communication. Individuals, providers should be communicating with and welcoming communication from their patients and consumers, especially those that are most impacted by these changes, as you indicated, which includes people with disabilities. So these really are tailored decisions in many instances, and I want to encourage everyone listening to connect with their provider if they have any concerns. The providers at my institution are eager to have these conversations and hear from their patient populations so that they can have the most information to make these decisions, because not all of this information may be included in your health record that they may be looking at, right? So reaching out to have this conversation and just encouraging people to initiate these conversations is critical.
Great, thank you so much. Do you have anything to add?
Well, actually, yeah, Bonnie leaves with an excellent point, which is a point that we make a lot, which is that people with disabilities have a very good perspective and knowledge of their situation, of their condition. And so even though complaints may be subjective, such as pain or chronic pain, or they may be things that are intangible, such as concerns about a condition that may continue to deteriorate while sort of sitting by waiting for this COVID-19 epidemic to pass. So for providers to be mindful of that and to make sure that that dialogue is open and respectful and make space to understanding that we know that there is no end date on this pandemic, but to the extent that you can help people set sort of concrete timelines, indicators into place, that's going to help folks have something to sort of hold on to. If there's an opportunity for some sort of nurse or case management who is just somebody that gives a point of contact for that person to check in with, and if you set sort of concrete timelines, to make sure that you keep those timelines. So if you're going to follow up with somebody every week, make sure that you do that, because folks are relying on that a lot of times as kind of the thing to get them by while waiting for real treatment. So thanks.
Excellent. Thanks so much, Jamie. All right, well, that's really a primer for some of the topics that we're going to delve a little bit deeper into during the series. So I want to thank all of you for your time today. Thanks to our audience for joining. And I want to thank Centene, of course, for their support of this series and for the entire Provider Accessibility Project. If you'd like to see us cover particular topics over the next few weeks, please don't hesitate to reach out to me. My email is simple. It's just tim@ncil.org, tim@ncil.org. And that's the right place to reach out to me if you have any questions after watching today's episode. Check back to our website, www.ncil.org, and you'll see the additional episodes start to populate. Feel free to share them with others and let us know if you have any questions. We'd love to hear from you. All right, thanks so much for joining us, everybody. Have a wonderful day. Bye.